And so we finished the procedure, and technically everything went fine. We put the electrode over the motor cortex part of the brain, and we were confident with the localization of that. So we've closed everything up on the scalp, and now we have to do the trial stimulation for the next week or so to see how much benefit this device gives her for her pain control. So she's just waking up now in recovery, and she'll go to the intensive care unit, which is on level 7. So if you go out to the lifts just out here and go down 2 floors, there's a neurosurgical intensive care there, so she'll be there certainly tonight, and we'll do a routine brain scan because everyone gets one after a brain operation, and we're going to put on some medicines to reduce the chance of her having any seizures, because that's a possibility after this operation.
Can you, and then will she be on the same medication as she always has been till you see what level?
I think so, yeah. We'll try and keep it as steady and constant as possible to get an idea of how much the stimulation helps her or doesn't help her.
That takes a while for you to...
Yeah, some people may get a benefit straight away, because during the operation we actually do some test stimulation to be sure of where we are on the brain. And some people, we need to adjust the settings on the stimulation over time, so time will tell. We won't do anything until tomorrow morning in terms of turning on stimulation itself. We'll just let her recover from the operation. And then tomorrow we'll connect, there's an externalised wire that we plug into a programmer box that will program up some stimulation for tomorrow. And we just have to see over the next couple of days whether there's any correlation with the stimulation and pain relief or difference in the pain, and so we can make a judgment by the early next week whether this has been helpful or not helpful for her.
Did you do some stimulation in the operation room for muscle contraction for the area?
Yeah. So we did everything like the standard textbook approach, and we were pretty confident that we're in the right spot.
Turn right. Thank you very much. Turn right, then turn left.
Now it's sort of up to her to see how we go.
Yeah, but you're going up that way.
Okay.
So go out here, turn.
So will she be here?
Go that way. So you basically
these elevators.
Yeah. Keep going.
It's sort of, we sort of do a couple of these a year, so I've only seen one done here previously. It sort of depends on how she how comfortable she is. We like to keep her here for a couple of days just to make sure the wound pain is settling down, and that there are no seizures. But after a couple of days, if she feels comfortable, it's possible that she could actually go home with this programmer device and see how she goes at home. The last patient we had in here, she was a bit sort of, she stayed in here until early next week. But if she's keen and motivated and is looking well, eating, drinking, walking around, and feels that she can manage at home, then it's possible that she could go home in a couple of days and continue the trial at home with us sort of seeing her in the clinic.
But she doesn't actually...
No, she can't adjust anything.
Okay.
No. Yeah. So...
you can monitor her from the clinic if she went home?
Yeah.
Is that accurate? So is there miles limitation? I mean, we're down in Corvallis and...
I mean, let's see how she goes over the next couple of days. As I said, the
I'll
last...
tell you, she'll be determined to go home. Yeah.
Sure.
I
Okay.
know she
Yeah.
Sure.
Yeah.
Well, let's just see how she goes over the next 1, 2, 3 days, and then if she's keen and motivated and understands what she needs to do and not do, then she could potentially go home on the weekend and come back to clinic on Tuesday, or just sort of do it in that fashion.
Great.
So will we be able to see her in
Yeah.
an hour, or?
Yeah, so if you go down to level 7, so if you come out here, just do a sort of U-bend around there, and go down to the lifts to 7, there's a sort of fork at the road where there are 3 intensive care units, and there's a big waiting area in the middle of all that. If you go there and introduce yourselves and say we're waiting for Julie to come to the neurosurgical intensive care, they'll be able to let you know when she's going to get there and when you can see her. So she's in recovery right now, and when she's settled there, then she'll go to the intensive care.
When she comes back, how long will she probably be staying?
What do you mean? When she,
Next
Oh,
week,
the second
Yeah.
surgery.
the second surgery.
potentially just one night. Assuming it works for her, she's happy, she wishes to proceed, then the the implantation of the hardware, the extension lead and the generator is practically outpatient type surgery, so it's not a long stay in hospital. 24 hours would sort of be the minimum time. Yeah.
Is it an actual pacemaker?
It works like a pacemaker. Yeah.
And is it like a new device? I don't know, I've just heard like pacemakers refurbished.
Well, we would-
No.
It would be the latest thing that Medtronic have to offer.
Okay, that's good. Do
So,
those have to be checked every so often?
yeah, they have a sort of half-life or shelf life, so it depends on what settings you set it at and what the output is. So if you're using very low voltages, they can last years and years and years. If you're driving it pretty hard at high voltages, then it may need replacement in 2 years or 3 years. So it depends on what settings you run it at. So there's a variation.
And that's just based on the patient's, how the patient's feeling as far as like the pain level, like, okay, maybe.
Yeah, I mean it's very much a sort of play it by ear sort of process here. It sort of depends on a number of variables, how she goes, what she reports her pain level as being. If everything goes well, we go to definitive implantation. So every patient is different.
Did you awaken her during surgery at all?
No.
Oh, I was thinking that she had to be awake.
No.
That was thinking.
So, anything else I can tell you, or you want to know?
So did you say you've only seen one other patient?
I've only been involved in one other patient's operation since I've been here. We have a number of patients floating around, but as you may be aware, it's not an easy operation to get insurance approval for. So we recommend this procedure for a number of patients, but it's quite a small percentage of whom who actually get the approval for us to put the device into.
We're on the 7th floor, and they're not getting reception down there.
Yeah, so
I didn't know if
that's
you
why
knew
it's
that.
we're not doing
Yeah, they haven't even actually
as
called
many
us.
as we would like to do.
That's fine, they just said every 2 hours they would check in.
And they haven't.
It hasn't been 2 hours yet, but I just
But
wanted
they
to.
should call, but yeah, down on 7?
Yeah.
I'll make a note of that.
Maybe
Okay.
because I even asked him.
Right.
I don't know.
Yeah.
I didn't know it was
Okay,
on 7.
that's where we are.
Yeah.
Peter Park, 7.
Thank you.
Nice.
But she never
Perfect.
complains.
Thank you.
Well, all we can do is sort of wait and see and cross our fingers and just take it one day at a time.
No,
Yeah.
I don't think that they.
Hang on. Okay, there you go.
Hi, I'm done. I made it to the other side. And I look forward to tomorrow when we can test it. So say a prayer and keep your fingers crossed.